Hi everyone, good Thursday afternoon and welcome to Smart Health on GoLocal Live. I'm GoLocal News editor Kate Nagel. Thanks for tuning into us here in downtown Providence. Would like to welcome in my guest today from the Alpert Medical School at Brown University, Dr. Alyson McGregor. Thank you for joining us today.
Thank you for having me. This is wonderful.
Well, this is fantastic. We do appreciate the folks over at the Alpert Medical School bringing us the experts in their fields. And you have a new book coming out, Why Sex Matters, How Male-Centric Medicine Endangers Females and What We Can Do About It. So before we even get to the new book, Doctor, tell us a little bit about your path to the Alpert Medical School and looking specifically at gender as it pertains to medicine treatment holistically.
So I am native to Rhode Island, which you know what people say about that. We don't like to leave this great state. So I did take a little tour of New England and undergraduate degree in New Hampshire, and then my medical degree at Boston University. And then I was fortunate enough to do my emergency medicine residency at Brown. And I've stayed there as faculty ever since. And it's just been really important to me to be a practicing physician in my own community. That was a goal of mine. So as I began working as a faculty member, it's a research center. It's an academic position. So there's a sense to pick something that you want to research. And I always thought of myself as someone really attuned into women's issues and women's rights. And so I said I wanted to do something related to helping the lives of women. And as I started to really sort of dig deep into how women have been viewed in the medical system, that's when I began to really explore this concept of sex differences.
And what does that look like? I mean, it's such a, I'm sure, a broad issue that you've studied extensively, but per that subtitle of the book, Sex Matters, what is male-centric, medicine? Why has it been so focused on the male, and how has that been a disservice to females? And again, this is a very broad question, so start where you will and give us a little insight again into how this is an issue.
Sure. When you think back to how evidence-based medicine really started to gear up, and we created the scientific method, and everyone agreed that this was sound science, that was about the time that there were a few examples where women of reproductive age would enter a study and then take a particular medication or have some sort of bad reaction while they were becoming pregnant during the study. And so there was this general sense that we should protect women of childbearing age, just to make sure that these things do not happen. And at the same time, researchers found that it was actually easier to study men because you didn't have to control for the stage of the menstrual cycle. Men's testosterone is fairly stable. It has some, lifetime variations and small daily variations, but it was much easier to study. And at that time, we were looking for simplicity. We wanted to make sure that we could really state that there was a cause and effect. And so women were dropped off the research pipeline, and all of our research on cardiovascular disease and stroke and cancer and infections were based on men and the male model. And it was thought that we could apply that data to women, and we'd be alike enough. And now we're realizing that women have a different biological sex, their DNA, and different gender identities that relate to cultural health and well-being that were not taken into account.
And how much has a disservice has this been to women, doctor, in terms of, as you said, that focus on the male in terms of research, trying to apply it to the female, and as you just told us, obviously it's apples and oranges. You've looked at it from a historical perspective, from a medical perspective. How much has it set women back that they have faced this until now? Because clearly this book and putting it in the forefront is trying to affect change. But how much, how problematic was this?
It is our medical and our health system is interrelated and it's entwined, and so it's very difficult to just make this change overnight. And so what happened was, as researchers were using the male model as a one size fits all of that evidence was then brought into medical education. And so that became the evidence that we use to educate doctors and health professionals. And so now those doctors are in the healthcare system, and they have been trained to look for male patterns of disease. So heart attack is a good example. Many women present with different symptoms than what we're used to thinking of: crushing chest pain and radiating down the left arm. And so when a physician is seeing a female patient and they have different complaints, say shortness of breath or not feeling very well, they don't fit into the paradigm that we've been taught. And so lots of conditions are missed or not understood in women or misdiagnosed. And so that has led to women having worse outcomes than men in cardiovascular disease and in stroke and in many other areas.
So let's talk about Sex Matters and the book that's coming out. Give us a sense of how you approach this, doctor, looking again at these differences. And when you set about to put forth this research and some suggestions as well as to how to change the system, how did you think about this and say, this is how I'm going to go about tackling this issue?
I really wanted this book to be more than just an expose. So there are some wonderful books out there now, some information about how our world has been male-centric and what are some of the consequences of that. And so I explain how we landed to this time that we are today. And I use examples of patient cases that I've encountered over the past 10, 15 years to describe some of the situations and how it's affected women. But I want it to be sort of something that can empower women. I want to empower women to be their own best advocate in the healthcare system. And so I teach them how to navigate the medical care and tips to be able to ensure that their care takes into account their own biological sex, being women.
And so obviously so much of healthcare right now focused on COVID-19. Let's talk a little bit about what we're seeing worldwide, doctor. I know we had the chance to chat a little bit before the show. The issue of the sexes as it even pertains to the coronavirus.
Yes, this pandemic has really highlighted some faults in our healthcare system. And it's also highlighted the fact that biological sex can be an extremely important component. So it's pretty, important to know that men have 2 times the mortality rate when they are infected with a severe COVID-19 infection. Okay, so then what we do is we say, okay, why does that exist? Is that because testosterone is detrimental? Is that because the lack of estrogen is doing something? Is that because of the immune system? We know that women have a more robust innate and immune system. And so perhaps it has to do with some of the chromosomal contents of immunity. Or is it social cultural behavior? And so by actually looking at all of these components, we'll be able to individualize treatments and have effective preventive strategies. And I think now is the time that it's for us to get this right, because we are fast-tracking therapies, fast-tracking the vaccines, and we want to make sure that these clinical trials are including both men and women, and they are designing them to study if sex differences are there.
So as we're in the midst of this right now, doctor, and as we're seeing colleges looking to wrestle, the medical field looking to wrestle holistically with the healthcare field, as we know here in Rhode Island, the governor just reopened hospitals to elective surgeries. You wear many hats, obviously, with the Alpert Medical School, with your research, with your practice. It's really hard to predict where things are moving forward. But, what's the talk amongst the medical field? You mentioned the urgency right now from your lens to say, make sure you take into account the sexes. But what do things look like moving forward? As you try to engage throughout the community, you're clearly in demand as a speaker to share your wealth of knowledge. But how do you envision things now moving forward? And specifically, as you mentioned, with coronavirus, but with your findings of your book, your discussions specifically to women to empower themselves. How do you move forward now, again, really kind of looking to change the landscape and making sure that gender is really at the forefront of how we treat both men, women across the spectrum?
I am very confident that we are on an upswing. I've been in this field before it even became a known field. And I'm very confident that the amount of evidence that we have right now that men and women are different is so exponentially growing, and it's you cannot ignore it anymore. I also think that the fact that the coronavirus has had a negative effect on men showcases the fact that this is not just a women's issue, that conducting high quality research that takes into account biological sex and gender will benefit both men and women.
And finally, let's talk a little bit about that Alpert Medical School role, that coming back to Rhode Island, that full circle, if you will, making your way throughout Rhode Island. Again, that research component, why is the Warren Alpert Medical School really at the cutting edge with the research that you do and with your partners in the medical community?
So the Warren Alpert Medical School and the Brown Emergency Medicine Group has really been my academic home for a very long time. And they are very special at providing freedom, yet also support. So I really was able to explore new avenues of research and thinking, and I was supported through the entire way, and was able to create a division, the first of its kind in the country, dedicated to researching important ways in which men and women are different in emergent conditions, and developing educational programs at the medical school for medical students and residents, and a 2-year fellowship program. And they've just supported my advocacy for this.
Well, Sex Matters, the new book by Dr. Alyson McGregor. So, Doctor, thank you for taking your time, again, shedding light both on the book and as we're looking here at the coronavirus epidemic, why, again, sex matters. So, Dr. McGregor, thank you for taking the time to join us. We certainly appreciate it here on GoLocal.
Thank you for having me.
Okay, we're going to let the doctor go, and we'll see you soon on live here in downtown Providence. I'm GoLocal News Editor Kate Nagel.